Now we move to the next speaker, Professor Adel from Tanta, who will speak about diagnosis and management venous leak.
Michael Washer. Bismillah ar-Rahman ar-Rahim. What about definition of venous leak? It is sometimes referred as senile hemangioma of the lips, and it is usually solitary, non-indurated to differentiate it from other lesions which are non-compressible and blue in color, and it is a papule. In the dermatology, you must differentiate between macule, papule, and nodule, occurring to dilatation of venules. Here is the name, venous lake. It is a benign lesion, and the most important differential diagnosis from melanoma and basal cell carcinoma. The definition is since about 50 years or 60 years, recognition of this case. What about the pathophysiology? To differentiate it from congenital vascular malformation. It is acquired form of vascular ectasia. And this ectasia may start from the capillary aneurysm, so it is considered a precursor or variant of venous leak. What about epidemiology? Incidence is unknown. There is no racial predilation. 95% of the venous leaks observed in males, but most of female patients will seek medical advice. And by us, in the pre-marriage time, because of difficulty of kissing, so they seek medical advice. The prognosis for venous leak, it is excellent because it is not a malignant disease, but it doesn't resolve on their own and evolve into serious such as skin cancer. No, it doesn't happen. But what about the complication? It is like venous problem in acute condition, either hemorrhage or thrombosis. Mortality from this case from hemorrhage, no record of cases, but excessive bleeding only. So it is considered biologically harmless. For the physical examination, we had said it is soft, compressible, dark blue papule, slightly elevated, up to 1 centimeter in diameter, well demarcated with a smooth surface. Compression often causes emptying of the blood content. How we can diagnose it? By diastrophy, we'll say about it. Typically, they are distributed in sun-exposed surfaces of the face and neck. Common site of involvement is vermilion border of the lower lip. Sometimes several lesions are found in the same person, and surrounding skin reveals actinic damage from the sun. Upper or lower lip. What about theories and causes? This acquired lesion may be due to injury of vascular adventitia and the dermal elastic tissue, due to long-term solar damage permitting dilatation of superficial capillaries and venous structure. Second theory, involvement of vascular thrombosis in the development of venous leak. We don't know if this thrombosis is precursor to the lesion or as a sequelae of the lesion. So it is present. What about differential diagnosis? Mainly from melanoma and basal cell carcinoma. Other lesion we can see it. How we can differentiate? By pathological examination, punch biopsy. But it is not like other vascular malformation. You don't need investigation such as MRA or MRI or MRV or CTV or so on. No, it is by clinical examination and diastrophy. What is diastrophy? It is just compression of the venous lake by the glass slide and will cause emptying and the color of the blood will fade. And punch biopsy or shave biopsy. Histological examination, we will find thin wall structure formed from single dilated space, and inside we may find the thrombosis like this picture. What about management? Could we use medical management such as venotropic agents, capsule, local treatment, or something like this? No. Non-proliferative vascular lesions that are not treatable via medical treatment. So, treatment must be surgical. What is the aim of surgical treatment? First, for cosmetic region. Second, to alleviate recurrent bleeding. Methods of treatment, we may use cryosurgery, electrosurgery, and sclerotherapy. From my personal experience, I have 5 female patients, and at the early period, I used surgery to excise it, and after that, I used sclerotherapy. All are reported to be successful forms of therapy for venous leak, but by injection, I am not sure about the pathology and histology of this structure. With a surgical excision, I was sure. Although all these modalities are economical, but multiple treatments may be necessary. Treatment of venous leak may be complicated by prolonged bleeding even after injection, swelling in the area reach of lymphatic, pain, texture changes in treated area, and scarring. Thank you.